and it's exciting. So
awesome.
yeah.
Good. Thank you guys for all going around and introducing yourself. I know Kate kind of started to do this, but now I'm going to have you go back around and tell us a little bit about life on your unit. For example, you could talk about culture, the type of patients that you see, maybe some regular cases that you see all the time, maybe a couple unique cases that you have seen before or recently during COVID, just some different qualities. And then maybe just talk about what would make a great candidate on your unit. So feel free to take a few minutes to explain. You know, we have plenty of time here. So Brandy, do you want to go ahead and go first again for that?
Yeah, sure.
Perfect.
So 5 West, we are the med-surg side of COVID. We take, I would also say, a little bit progressive care. We take a lot of patients with a lot of high oxygen needs prior to them needing to go to the ICU if they were to need to. So med-surg though, anything and everything you can think of. And I think the cool thing, we were a med-surg unit prior to COVID. What we've added in with our med-surg is like I said, we get everything. We see cancer patients, we see trauma patients, we see cardiac patients, we see anything and everything related to whoever gets COVID. The only thing we don't do, obviously I said, is ICU, and we do not do pediatrics. So those are the two populations we do not see on 5 West. We are about a 26-bed unit, but we have the capability to increase our numbers and add in any semi-private rooms if we were to need to. So if our COVID numbers go up, we can pair COVID positive patients together if need be. So we always have to be prepared for that. The fun things about our unit, it is very fast-paced, very busy, on your toes. Patients get sick quick. We're finding that a lot with this COVID business. They can go downhill very, very quickly. I think one thing, our nurses that were on my unit prior to COVID and now into COVID, they've been, it's been really exciting for them to see that change. You know, prior to just, general med surg, we didn't see the patients decline as rapidly, things like that. They're now getting that piece of maybe a little progressive care level of patients, so a little higher acuity of patients that we're seeing. So like I said, very fast pace, high energy. I think that's what I love most about my staff. They are so high energy. They love what they do. We have very much on 5 West, we're kind of known across the organization for our teamwork, and that has become even more relevant with COVID. Gosh, you need teamwork like nobody's business with COVID. If you think about all the PPE that you have to wear with COVID, the face shields, the N95s, the gowns, the gloves, all that stuff, and you go into a room and you get busy and forget something, you're gonna be calling out your team to bring you that thing, because you don't wanna have to completely doff everything off, go get your stuff, don everything back in, come back in your room. So our teamwork culture has been even, like I said, more just even better than what it was before. So it's been really fun to witness that. So very much a teamwork culture. We're also very much a teaching culture. So I hire a lot of brand new graduate nurses. That's kind of what we're known for. So our team, they love to teach. They love to teach new nurses. They love to teach new care techs. Anybody that wants to come to our unit and learn, we're willing to do that with them. What else about 5 West? It's just fun. We just have a really good time, a lot of smiling, just everybody, it almost feels like a family. I think that's what we really view that as, is just our own little 5 West crazy, chaotic family. So we just have a lot of fun. And so if you're interested in coming to learn and just really join a family and a good culture of teamwork, 5 West is a really great place to start. The other cool thing about it is we totally get it. Med-surg is a starting ground for a lot of new nurses, and we are totally okay with that. You come here, you come to our unit, you learn for a couple years, and we get you that great experience. And then maybe you go to the ER with Kate, or maybe you go up with Christina to the ICU, things like that. We love teaching people to get them to where they want their end goal of nursing. So we love to do that as well.
That's a great point. Thanks for pointing that out. One thing, I don't know if you mentioned, I was Skyping Sue quick, but can you talk about the ratios, maybe like nurse to patient ratios, as well as the nurse to patient care tech ratios?
Absolutely. So we've realized with COVID that with the amount of PPE that we have to use, we have had to decrease our ratios a little bit compared to normal med surg. So normal med surg ratios are 1 to 4 on days, 1 to 5 on nights. On our COVID units, we've kind of shifted that a little bit, and we're more that 1 to 2 to 3, and then 1 to 3 to 4 on nights. More days is 1 to 3, 1 to 3 on nights as well, and then you might get an admit on top of that on nights. But we really try to keep that around that. Our care techs take anywhere from about 6 to 8 patients per one care tech. So we've also tried to kind of really keep those ratios low, like I said, just with the amount of PPE that our staff have to wear.
Awesome, thank you.
Mm-hmm.
Any questions for Brandy before we move on to learn about a different unit? And we can always save questions for the end too, and if you guys don't want to say them out loud, feel free to put them in the chat and I can address them that way as well. But Christina, maybe you guys want to go next, talk about 7UT?
Absolutely. So 7UT, like I said, is a newly established unit. The unit was opened in March when we really saw the prevalence of COVID hit our area. So it is brand new. We are currently working on establishing a core staff for our unit. So really building our culture, and everybody that joins us gets to be a part of that. And I think we have the really fun and unique opportunity to kind of build this unit into what we want it to be, which is awesome. The goal would be that once COVID numbers go down enough, if or when, this would be the sole COVID unit at Nebraska Medicine. So we do take all levels of care. We take ICU, progressive, and med-surg patients. The mix of those patients varies day by day. It just kind of depends. But like Brandy said, a lot of these patients get sick, and when they get sick very quickly. We have seen kind of a whole different level of acuity with our COVID patients. You know, our patients on ventilators are very sick. We do a lot of paralyzing and proning of our ventilated patients. It's just an interesting place to work at. I think one of the things that's unique, I don't think that Brandy touched on, is just with the visitation policy. We don't allow visitors in our COVID units. We do have tablets for every single one of our patients. So our staff really spend a lot of time helping families get connected with their loved ones and giving updates and making sure that people can FaceTime or Zoom or do those types of things to keep them informed. Really our staff up here becomes that patient's family for the duration of the time that they're here with us. So like Brandy kind of talked about, the teamwork is absolutely paramount. You have to work together up here to get the work done, and I think it naturally draws people closer. So we have excellent teamwork up here. People definitely take responsibility and treat their patients like family, which is fantastic. Since we are the unit that will take any COVID patient, we also take adult and pediatric patients. So any patient that would test positive for Nebraska Medicine could come to our unit. So like Brandy talked about, it's also a unique opportunity to really see every type of patient. It might be a patient that came in for a trauma, but they tested COVID positive, they would come up here. It might be a cardiac patient that tested positive and they would come up here. Emma, do you want to talk a little bit about your experience of working on the floor?
Yeah, so with my ICU experience, when COVID really hit, I came up here to help as an ICU nurse. And the teamwork that I have seen up here with how sick our patients become so quickly is nothing like I've ever seen on any other unit. Even though we've been sourcing staff from other units, we've been fortunate to have nurses floating into us to help. Everyone truly works together as a team. What's really unique about here, like Christina had said, is that we can have a med-surg patient who comes in that tests positive. And I mean, they can progress so quickly to being needing to be intubated that you could go from having a med-surg patient in the morning to having, you know, an ICU patient in the afternoon. So we're excited about training our staff to be able to take care of all levels of care.
So when somebody's applying to that unit, are you looking for somebody with experience, or because you could have med-surg patients, is it an appropriate fit for a new grad?
So currently, since we're hiring our core staff, we are looking for a little bit of experience. We are open to new grads in the future. We want to make sure that our new grads have the support that they need when they get started. And just because we have so many float staff right now, I think it's important that we get a core staff established here. And then I think in 6 months or so, if there's any of you May grads out there, 6 months or so, that story might look a little bit different. So just kind of depends on where we are in the application process.
Awesome. Thank you. Jen,
Yes. We also have, oh, sorry.
Oh, go ahead, Christina.
The only other thing I was going to mention is we also have a critical care team that is housed up here on the unit. So they are up here with us 24 hours a day. So we always have that physician backup. If we ever have concerns or needs, they're literally just right down the hall, and we can pop in their office and say, hey, can you come help us out here? So we work very, very closely with our physicians. Our respiratory therapists are definitely part of a team. They also have an office up here. So it is not just a nursing-based unit. We really are, we really work really closely with the rest of the multidisciplinary team.
So that's a great explanation. Thank you, guys. So Jen, I know the PES hasn't fully opened yet, so you might not have all of the different case examples, but do you just really want to talk about the goals for that unit and how you see that looking over the next year and long-term?
Yeah. Sure. So, you know, we akin, and hopefully Kate will agree with this, that, you know, the PES is sort of the little sister to the emergency department here at Nebraska Medicine. You know, I don't know if this would be surprising to anybody, but 1 in 8 emergency department visits are for somebody presenting with mental health or co-occurring substance use issues. And if you've spent time in an emergency department, that's not always the best environment for what that patient is experiencing. And so we've really seen an increase at Nebraska Medicine's emergency department in the last 5 years. We've doubled the number of patients presenting with that chief complaint. So we really wanted to be able to create a space that was uniquely tailored to meet those behavioral health needs. That's a little bit different than a more traditional medical environment. So that's kind of where PES came in concept. We've modeled ours after the program at University of Michigan. There's really 2 different treatment spaces. One is a more open observation kind of space with big recliner chairs, where people, as they're being triaged and assessed for kind of that next step and what their needs are, we can give them a space that's sort of decompressing, stimulating, quiet, relaxing, provide some individual therapeutic intervention in between. And then we also have a secure side, which would be for that person presenting maybe who's a little more agitated, more impacted by the symptoms of their illness, who might require a higher level of observation. If we had to do restraint and seclusion, we can do that. That's obviously the last thing that we would, you know, want to do with someone, but we also want to make sure everybody is safe and that symptoms are as best managed as they can be. So really the PES itself is designed to kind of almost be like a Grand Central Station where we assess somebody and then decide what do they need from there. So that could be that the person needs transfer to inpatient hospitalization, and we would help facilitate that. It might also just be that the person has not been on their medications for a little bit and we need to get those restarted, or they've disengaged from treatment with a previous provider, or maybe they need to get connected to a community resource or something like that. So those are all the kinds of things that we're hoping that we'll be able to do to really meet the needs of the people that we're serving in a very compassionate, sort of non-institutionalized space where they can be affirmed in their help seeking and that they'll want to continue to do that. So we're really excited to get started. You know, I can't say enough about how wonderful and helpful our emergency department has been over these last few months of orienting our staff. We've had a few delays here and there. COVID certainly wasn't a part of our plan when we were developing this unit. So they've been really great to work with us, and hopefully by having the PES, that will also help them with their own throughput and just ability to help with the patients, because there are a few times where it does take longer than 24 hours to get somebody placed for that inpatient mental health bed. And so that ends up keeping a room in the emergency department for somebody for could be up to several days. So we hope that us being able to provide that space for individuals in mental health crisis will also help with the needs in our own emergency department too.
And are you seeing both adult and pediatric patients?
This is for adults. It's adult
Adults.
psychiatric emergency. Mhm.
Perfect. Well, I feel like that is a nice transition then into the ED. So Kate, if you want to talk about this, I know everyone loves hearing stories from the emergency room, so.
We are never out of stories, that's for sure. Good morning again. So kind of what I said earlier, we are a large unit. If you've ever been in the emergency departments, divided into little mini pods, if you will. So we have a fast track RAW area, and what that is we see our lower acuity or more like clinic type patients that check into the ER. As you know, access to healthcare isn't always easy for everyone in our community. So we're kind of the opening gates to our community around us. So people see us for all different reasons. So that fast track RAW area is our clinic area where we see, you know, sinus infection, strep throat, abrasions, lacerations, things of that nature. We have a little pod after that. That's kind of our psychiatric area that now Jen will help absorb those patients so we can better care for them. Then we have another area of patients that kind of are middle ground patients. Since we're an emergency room, we do see everyone. So we see a lot of, quite frankly, pain, abdominal pain, headaches, migraines, whatever. And it's our job to help suss out, is this a true emergency? Is this a chronic issue, or what's going on here? And then we have 21 critical care beds and 4 trauma bay beds. You know, it's kind of nice seeing all the other managers from the other units here, because we touch everyone in the hospital. And it's great that, you know, Brandy sends, kind of how she was implying, we have some amazing nurses that had 2 years up with Brandy, and then they came down and they're working with us. And so we are jack of all trades, if you will. However, all of our nurses kind of have their little subject area they're very interested in. You know, so maybe someone that worked in 5 West is very good at wound cares or something of that nature. Maybe someone that came from the COVID unit down the line can help us with that. So that's a great, we really appreciate working with other managers. Let's see, as far as stories, oh my gosh, I don't know. We have traumas, obviously. We have medical emergencies. We have really anything you guys can ask me. I've probably seen it. Ratio wise, in that clinic area, we're kind of a 1 to 8 because it truly is a clinic type experience. In the non-critical care area, we're a 1 to 4 or 1 to 5. Our critical care area is a 1 to 3, with the expectation that if your patient suddenly gets very ill and has to be intubated or something of that nature, you're a 1 to 1. Because of the fluidity in our department, teamwork is an absolute must, and positive attitude is definitely something that everyone has, working together. And then also, because we're an emergency department, a lot of our staff have an adventurous side to them. They're high adrenaline, they're active, they're moving type people. Anything else, Erin?
No, I think that pretty much sums it up. So we can let Annette go, and then if you guys have any questions, we would love to answer those at this time. So.
Oh, and we do have an ER fellowship. That's about a 9-month to 1-year program.
Yes. Yep. So that would be how new grads are hired into the ED through the fellowship, and we can chat more about that too after Annette goes if there's questions. So take it away.
Okay. Yeah, so on 9 trauma is a really busy floor. Your time will go by super fast. Our patients, of course, are like car accidents, stabbings, gunshot wounds, assaults. And then we have emergency surgeries like gallbladders, appies, small bowel obstructions. So our patients do not expect to be on the trauma floor. They don't have a lot of time to process sometimes what is happening to them. So one of the challenging parts of my floor is kind of dealing with the psychology, and dealing with their pain, and dealing with head injuries. We have a lot of head injuries on our floor. So our nurses are learning how to be patient with them and be calm with them and kind of help them get better, which our patients are on our floor sometimes for a long period of time just because for insurance, we can't get them to rehab. So we do get to see them get better. So that's a little bit of the rewarding part of working on my unit. It's just a really good learning floor. If you can work on 9 trauma for a couple years, you can basically work anywhere. We do get drips, a lot of chest tubes, lots of drains. You just see a lot of different things on my unit. And as far as teamwork, we have to have good teamwork on my floor because most of our patients cannot move on their own. So everybody's always helping everybody. It's a very physical floor. You're always moving. There's always something to do. And then of course we just, for our culture, we try to keep a growth mindset for our nurses. So we're really trying to support our new grads, and then like their next step would be maybe precepting or relief leads or joining committees or just trying to find new ways to make the nursing process easier. So what else? What other questions?
So yeah, so 9 trauma is a trauma med surge, but
Yeah,
I've heard it compared to like what a community hospital would consider an ICU, just because of the nature of the traumas that Nebraska Medicine sees, you know, being the level 1 trauma emergency department, trauma surge is a little bit higher. So I think it's a really awesome floor for new grads to start on that have an ultimate goal to be an ED or something like that.
Yeah, we're a little bit progressive on our floor depending on the week, but yeah, it's super busy, and I've been told it's one of the busier units in the whole hospital. So it's very good to learn.
Well, thank you.
Yeah.
Yeah. So what questions do you guys have for the managers? This is your chance to kind of ask them what you want to know, and they can help you kind of decide whether their unit would be a good fit for you or not.
I have a question. So this is an area that's always interested me, and for a very long period of time, people have said like it's a very difficult unit to get a job on. I was just wondering, like, you guys had briefly touched on like hiring new grads and everything like that, but also what you're expecting out of them, and I don't know, anything that goes along with that.
Anyone want to jump on that one?
I can take it from the emergency room perspective. We do have a fellowship where we hire new grads. We usually take 1 to 2 at a time. We are looking for someone that's highly engaged, wants to be a continuous learner because it's an emergency department. We, you know, stroke and chest pain and transplant, we kind of have to know a little bit about everything. So you definitely have to be a lifelong learner, if you will. And someone that's excited to just jump in and get moving.
I would totally agree with Kate. Same thing on 5 West. No, I'm constantly hiring new grads. So interviewing, hiring all the time. So same thing, very highly engaged person that just wants to come in and learn and get their hands dirty and just jump right in, learn the patients, learn the system, learn the unit. Want to jump into our overall Nebraska medicine culture, you know, live our I teach values, you know, be innovative, especially with COVID. My gosh, I have never seen so much innovation across our whole organization and on our unit and Christina's unit in the last 6 months than I have in the last 14 years. We are just constantly developing new practices, new processes. Just because we did it this way last month doesn't mean we can't find a new way to do it even better. And it's coming from brand new nurses and, you know, nurses of 10 years. It's coming from everyone, physicians, care techs. We're just constantly wanting people to be innovative and, like I said, just get their hands dirty and jump right in.
Just to kind of add on to that, absolutely. We're looking for people that are flexible and open to change. Like Brandy said, things are changing all the time up here. And as you can imagine with COVID, we're part of clinical trials and changing the way we treat COVID all the time, which is really exciting. So just like Kate said too, just lifelong learners, people that are willing to kind of jump in and figure out what we're doing next. And it's exciting and it keeps you on your toes. No day is going to look the same as your last. So it just is an opportunity, I think, to, it's not somewhere you're ever going to get bored. So, you know, there's always something new. And especially with us being a new unit, really looking for people that we want people to come here and feel empowered to help set our culture the way we want it. And we want people that are engaged in that and, you know, really have ideas for how to improve things. We want to hear what people think is going to work best. So.
On that, it looks like we are going to move back into the main room, and then we will be in our second breakouts very shortly after we hear from Sunas. Welcome back. Hope you guys enjoyed your little breakout rooms. I'm going to go ahead and share my screen again. While I'm sharing my screen, if you guys want to type in the chat function what your favorite thing was about your breakout room, or maybe what you learned that you weren't expecting to learn, we would love to read those comments. Okay, so Sue, if you're ready to go, we can definitely get started with you, and then you can announce your winner and all that.
I'm going to announce my winner at the end of my session, if that's okay.
Perfect.
Okay. So good morning, everyone. Welcome to Nebraska Medicine's first virtual open house. Thank you for joining us on this little dreary Saturday morning, but thank you for being innovative with us. It's kind of fun to do. I love to see the breakouts when everybody comes back. It's really kind of cool. So I'm just going to take a few minutes to talk a little bit about Nebraska Medicine, about Nebraska Medicine nursing, and a little bit about my story. Next slide, please, Erin. So not sure if you're aware, but 2020 was named the year of the nurse and the midwife. And we celebrated this in nursing forums in January at Nebraska Medicine, just as COVID was starting. And who would have thought, any of us, who would have thought that the year of 2020 would have so much for nursing? It's been a very unique year. It's been an unprecedented year. But how wonderful the opportunities that all of us as nurses have had during this year. Next slide, Erin, please. Here are some of our COVID unit staff members. Just wanted to share some pictures so you can see some of our colleagues. And so let me tell you a little bit about Nebraska Medicine. So in the Metro Omaha area, we have 3 main campuses. We have the main campus that most people will think about at 42nd Street between, well, now it's between Dodge and Leavenworth, really. It's on the same campus as UNMC. But we also have Village Point out at about 168th to 180th and just by Village Point Shopping Center. And then we also have our Bellevue campus. We have 2 hospitals. One is called Nebraska Medical Center, which is the main campus one at 42nd Street. But then we also have a hospital inpatient tower at Bellevue Medical Center, which is on 370. Just off of Highway 75. We have more than 800 licensed beds across the 2 inpatient hospitals, but we have care that extends across the region. We actually have about 40 specialty and primary care health centers, and we actually have clinics in Lincoln at the health center on UNL's campus, and also out in Grand Island. So you can see that our footprint is starting to spread across the state and not just in Omaha proper. We have more than 1,000 physicians. We have more than 8,000 employees, and our promise is serious medicine, extraordinary care. Next slide, please, Erin. This is one view of our main campus. You can see that it kind of continues to expand. Next slide, please. This is a picture of our Bellevue Medical Center campus, again, right on 370. Next, please. And this is our Village Point, just a shot of our Village Point. So you can see that we do spread across the city. Next slide. So let me tell you a little bit about Nebraska Medicine nursing. We have over 2,500 nurses across the organization. And between our 2 hospitals, we have 25 inpatient units, critical care, progressive care, med-surg, pediatrics, PICU and NICU, and also women's services. You can tell from your breakouts that we have oncology, heart and vascular, solid organ transplant, trauma, neurosciences, orthopedics, just to name a few. We also currently have 3 units that are dedicated as COVID units so that we can have a place for patients to go, especially if we have an upsurge with COVID moving forward, especially when flu season starts. We do have 4 surgical or procedural locations. We have 3 infusion centers, and we have 2 emergency departments, and very soon we will be having a psych emergency services emergency room type unit that will open very, very soon. I'm not going to say the date just in case, but it's very, very soon. But the other thing I want you to know about is that we are a magnet organization, which I think is very important. Next slide. Here's a group of our ambulatory folks. This is from our dermatology clinic. This was early on in COVID. And you can see our shirts, UNMC and Nebraska Medicine strong, which has been our motto throughout all of COVID. Next slide, please. So I'm not sure how much you have learned about magnets in school, but I want to share with you what's the benefit of a magnet program in a hospital that's magnet designated. Basically, hospitals that have the magnet designation recruit and retain top talent, hopefully recruiting all of you that are on the call today. But magnet hospitals also improve clinical outcomes for patients. There also is an improvement in satisfaction, both nursing and patient. Magnet hospitals foster a collaborative culture. So we have interdisciplinary teams that work together to care for our patients and to make improvements. We also, magnet designated hospitals, advance nursing standards and practice. We're innovative and we listen to the nurses, and if they think of something that we think could be done better, we work with the nurses to make improvements. Magnet hospitals also help to grow the business and financial success of the hospitals. Next one, please. Here's some more of our team members. I'm gonna try and read it. I had notes, but I forgot to write them down. Okay, it says, I am a nurse. I'm not gonna be able to read it. Basically, this was our 9 trauma team that did this during COVID. When COVID first hit, we were very innovative, we were very energized and had a lot of adrenaline rushing through us. And then as we realized that COVID was going to carry on and on and on, it's kind of made us a little bit, it's pulled us down a little bit. So the 9 trauma team put this together just as a pick-me-up. And I'm sorry that I can't read all the signs, but it's just a very nice, it basically talks about, I care for you, I care for your family, we're here for you, and we are Nebraska Medicine Strong. So, okay, next slide. So here's my story. I'm 58 years old. I was born in New Jersey, but I've lived in Omaha for almost 25 years. I've been married to my husband, Joe, for 32 years. We just celebrated our anniversary on Thursday, but I've actually known him since 6th grade, so known him a long time. We have 1 son, Josh. He is 26, and he currently lives in New Jersey. And most of our extended family is in the New Jersey, New York area. Next slide. This is us. We are diehard Notre Dame fans. We are very sad that football season is kind of strange this year, and that the Notre Dame football team has had COVID for 2 weeks now, so we're not even able to watch on TV. Normally we go once a year, and actually we were supposed to go to Ireland to see the Notre Dame Navy game in Ireland this year, but we couldn't go. So anyway, that's us. But here's my professional story. I've been a nurse since 1982, so quite a long time. I started out with an associate degree that I actually got from UNMC in 1982. But then my father, who worked for an oil company, had been transferred a couple times. So I moved to Syracuse and got a bachelor's in Syracuse in 1984. I then worked in a general pediatric unit for a couple of years in Albany, New York. And then I really thought that I wanted to teach in a college of nursing. So I went back to New Jersey and got my master's at Seton Hall. But instead of teaching, I became a nurse practitioner, and I worked as a nurse practitioner in a pediatric oncology clinic for for about 8 years before we moved to Omaha. And then again, I thought I wanted to teach in a college of nursing again, so I got my PhD in 2007, but every time I go back to school, I find myself still wanting to stay in the clinical arena. So hence why I have not gone to a college of nursing just quite yet. When I had the opportunity to become the chief nursing officer at Nebraska Medicine, I realized that my first degrees were great in nursing and gave me a great solid foundation for nursing education, but healthcare is a business. And so I decided that I needed to get my MBA so I could have a better understanding of the business aspect of healthcare. So I got an MBA in 2017. Most of my experience has been in pediatric oncology, and I've been in leadership for 13 years. and I've been the chief nursing officer for 6 years. One fun fact is that I did not pass state boards the first time. And if you were to ask the faculty in the associate degree program at UNMC in the early 80s, if I would have ever aspired to be a chief nursing officer, they would have laughed at you because I was a really bad student. But I tell you this because look where I am now. So just one bump in the road doesn't really matter, right? You will hear in the next hour or so from two of our managers. One is going to share her journey at Nebraska Medicine. That's Shonda Ross, and she, I believe, follows me. And then later on, you'll hear from Kaylee Guinan, who is a manager over our nursing professional development specialists, basically our nurse educators. And you're going to hear about our nurse residency program. And I would suggest that you really do pay attention to what they have to say about the nurse residency program. Recently, I talked to one of our newer nurses who came from another system. And so she's an experienced nurse, but she's newer to Nebraska Medicine. And she shared that she wishes she would have had a nurse residency program in the location where she started right out of school, because she said it's amazing how much support a nurse residency program has for new nurses. So that's the end of my story. I wanted to thank you again for joining. Oh, sorry, here's another picture. Oh, there's Shonda Ross. She's the one on the far left. So you're going to hear from her in a minute. That's her clinic team, just being Nebraska Medicine strong. And again, I want to thank you. I hope that you're getting some good information. Would love for you to choose Nebraska Medicine. It's a great place. There's a lot of things to do. We care for newborns, even preemies, up to elderly people and deaf and everything in between. And so it's a great place to work. With that said, I am going to announce the winner of the gift card is Bridget Geary. So Bridget, I don't know where you are, but thank you for joining us today and congratulations to you. And I'm going to stay on to hear Shonda's talk, and then I do have to jump off. So thank you all again. Thanks to the recruitment team. They put a lot of time and effort into this, especially figuring out the breakout room. So thank you all and have a wonderful day.
Thank you.
Thanks so much, Sue, and congrats, Bridget. We will email you probably Monday and get that gift card over to you. So you are the proud new owner of a $50 Amazon gift card. Yay. So up next, we are going to hear from our clinic, or one of our clinic nurse managers, and that is Shonda Ross. So she doesn't have slides, but I will just leave this screen up, and she is just going to kind of present at free will. So have at it.
All right. Good morning, everybody. This is what I do best. I do best at juggling and, not having things in front of me. So if you haven't heard, in the news this week, we had things happen at Nebraska Medicine as far as our electronic system. So I couldn't get to my drive to create the fancy slides like Sue. I'm sure Sue was already prepared weeks ago. So
I just did it the other day.
But I didn't have an opportunity to have slides for you. So hopefully I will entertain you with my conversation as well. So I am Shonda Ross. I am a clinic manager at Nebraska Medicine. I am coming upon my 22-year anniversary at Nebraska Medicine. So for me, I am an Omaha native, born and raised here, although you may hear a little bit of a Southern twang. That is my family background. So I visited the South every year for the summer, so it just kind of stuck. And down there I talk proper, up here I talk country. So here I am. Married to my high school sweetheart. We have been married now for 25 years, have been together for 34. Wow. We have 3 children, 2 grandchildren, 2 little girls, and then 1 grand dog. My youngest is attending Iowa State. She does not like children, so she decided that she would get a dog right now in her life, at this stage in her life. I have obtained my bachelor's degree at Methodist, and I obtained my master's degree at Clarkson that I did have the opportunity to obtain, I will say, with minimal financial cost to me, because I was very blessed at Nebraska Medicine. We do have a tuition reimbursement program, so that allowed me to be able to get my master's degree without having a lot of financial obligation on my plate. So I will say that I always wanted to, while we are called Nebraska Medicine, When I first got into nursing, it was Clarkson. And I always wanted to work at Clarkson since I was a little girl. I knew I wanted to be a nurse at 5 years old. My mother has always had health issues, and I was just considered and deemed her healthcare person. I knew how to take her blood sugar. I knew how to give her insulin. I knew how to call the rescue squad when I needed to. So a lot of responsibilities for little shoulders, but I took it on and I loved doing it. So I told her that I was going to be a nurse so that I could take care of her for the rest of her life. So when I was at Methodist, of course, they were recruiting their own students, but there became an opportunity where we could come to Clarkson College to get what they called an internship the summer before graduation. I took advantage of that internship, was able to work on our 6th floor, which was at that time called subacute rehab, where patients who weren't quite ready to go home and needed some nursing care, they came to that unit. So it was a mixture of rehab and med-surg. I was there for the first part of my career, and then from there, opportunity. And by the way, I got hired before I graduated. So talk about pressure. I really needed to make sure I passed them boards. So thank God I did. I had a job ready and waiting. I was on that unit for a while. We went through some changes. I went through one of the first mergers for Nebraska Medicine and UNMC coming together. And then we did another change in our unit that changed it over to a newer unit. Wasn't quite my cup of tea. I was at that time what we would call a cares nurse, and the cares nurses would work the weekends, you know, from Friday, Saturday, Sunday, or Saturday, Sunday, Monday. And so we would float to all the different areas. At that time, I was ready to get my master's degree. I think I was probably 5 years in. Part of that requirement, though, for nurse anesthesiology, which is what I thought I wanted to do. Did not think that it was going to be leadership like what Sue was saying. I said, manager, no. Bedside nursing is all I ever thought about, right? So I transferred to the unit, and I had a few things occur personally in my life. My mom got really ill. She had been a transplant patient. I didn't mention that. My brother was able to donate a kidney to her. She had a fall and ended up in our unit, so I had to take some time off. In the midst of that, she got really ill. I'm so thankful to my manager at that time, Chad, who was on that time and took time off and worked with me with my schedule. Then my mom ended up dying in the midst of that. I ended up hurting my back. I had to take time off of work. So then I was told from Chad and HR, due to the restrictions, that I could not come back and be a bedside nurse. To this day, that chokes me up because it was something I was really passionate about and I enjoyed. Had not thought about doing anything else. And my physician and HR said to me, there's a lot of opportunities in nursing that are outside of bedside. You just hadn't thought about them. So I started off in one area, changed my thought and thinking. Master's and degree was then going to change the leadership because I had been encouraged that I had what it takes to be a great leader and they would really like to grow me. So from there, I went into a lead position in our transplant clinic. And then from there, my management career, once I got done with my master's degree, just continued to climb. I was a manager, and then I'm trying to keep track of time, y'all, because I didn't write my slides, so I want to be respectful of that time. As a manager, I then had the opportunity to grow, learn new things. An opportunity came open for me to help out another area, which is our bariatrics clinic. So I had our multi-organ transplant clinic. I was the interim for our bariatrics clinic. Things were working really well. They decided to have me take on both of those under my wing. From there, our director for our program, which that clinic was up under transplant as well, opened up. Our director decided she was going to retire. So I took the courage, I applied for it. From there, I received the opportunity to become the director. And being the director, I also still had my position for being the manager open. So I was kind of multitasking. Things took place as they did with financial in the world, and Nebraska Medicine needed to make a decision to pivot. I am proud to say that we pivot really well. When we need to make adjustments to things, we do. And so as a nurse at Nebraska Medicine, the expectation is that we pivot as well. So I had a conversation with Sue who had been mentoring me as I was new to being a director, and my VP, to say that things needed to change. We made some shift and changes in leadership. So there needed to be a shift and change in my position. So moved on from being a director and was told that this is not anything that you did wrong. This is just what we need to do. And we actually need your experience over in this clinic, which is a pretty big ship to run. And we just have not had the opportunity to do it. So we would like you to take this opportunity to continue to grow, to continue to learn, and run this other area, because you're really good at building teams, you're really good at building relationships and helping get things in order of where they need to be. So that is the seat I sit in now as the Internal Medicine Specialties Clinic. So I will say at Nebraska Medicine, you can go and grow in whatever direction you want. You know, as Sue said with her boards, her bump in the road was not passing the first times. My bump in the road was, I'm a director and now you're coming to me and tell me that I got to move back over to a manager. Moment. But it's a fun fact now, because I actually have learned a lot more things. I've had the opportunity to continue to grow and learn, and I'm not done. I'm still looking. We have awesome opportunities at Nebraska Medicine. You're always encouraged to go and grow. You can have mentors from other nurses. You can have mentors from people in other departments. It's just really up to you. So you can come in and it can just be a job, or you can come in and it can truly be a career path in somewhere that you can grow as a person. I'm very passionate about diversity, equality, and inclusion. So Sue and everyone has allowed me to really grow in that department also. Y'all see I'm passionate, I talk with my hands. So just want to welcome you all. I hope you consider coming back to Nebraska Medicine. If you have any questions for me, feel free to jump in and ask, or reach out to the recruiter and let them know.
Thanks, Janda. That was great. So I will give you the name of your gift card winner at the end of, or during the breakout session too, and you can announce them right after that. So that will be super exciting. I want to point out the fact that she really highlighted growth within the company and all the different opportunities. So even if you start here as a patient care tech while you're working on getting that nursing degree, there's just so much room for growth, and you really can make it a career. I guess I did a poor job of introducing myself this morning. So I am a sourcer on the talent acquisition team. And a really neat thing about my job is that I get to learn about all of the different positions in Nebraska Medicine. So you're always encouraged to reach out to me and say, you know, I'm ready for a change. I'm ready for something new. What are the opportunities out there? And I would definitely be more than happy to have that conversation with you and to really work on your professional career growth as well. So you can have a cool story like Shonda and Sue and all the rest of the awesome Nebraska Medicine staff. So we are a little bit ahead of schedule, but Tara, if you are ready, we could go ahead and jump into our breakout session number 2.
Once again, if I send everyone to rooms and you remain in the main session, just hold on and I will send you to your room. But I think we should be good this time. So I will send you there now.
Thank you. Hello, everyone. Trauma session number 2. Looks like we have a good chunk of people this time, super interested in learning about trauma. So I'm going to go ahead and hit, oh, actually mine's still recording from last time, so perfect. Okay, so everybody joining us this session, hello, welcome. If you're not meant to be in trauma, let me know and I can get you, we can get some help and get you moved. But got some really great units here. They're going to talk about life on their unit, their culture, some unique stories that they have to share, talk about ratios and what it takes to be a great candidate on that unit. So what I did last time, I just went around and had everyone quick just introduce themselves in the unit that they work on. And then we went a little bit further in depth hearing about what life really is like being a nurse on that unit. So as we're going through that, feel free to type any questions that you have using the Q&A function and I can kind of field them that way. Otherwise, we will allow some time at the end for some verbal questions and conversations as well. So we will go ahead and get started. Brandy, you did a great job kicking it off last time, so I might just let you do that again.
Absolutely. So my name is Brandy Johansson. I'm the nursing manager of 5 West. Our unit was asked to convert to a COVID unit back in March. So we have been living the COVID life since March. Prior to that, our unit, which will eventually turn back into a general medical surgical telemetry unit. I have been a nurse for 14 years, all of my time spent on 5 West at Nebraska Medicine. It's a great organization to be able to grow, as Shonda and Sue talked about. And I've been the nursing manager for about 3 years now.
Thank you. Christina, next.
Hi, my name's Christina Johnson. I am the manager of 7UT. 7UT is a newly established unit. It opened back in March when we started seeing COVID cases in the Omaha area. So we are the newly established COVID unit. And then I have Emma with me.
Hi, I'm Emma Knorr. I am the daytime nurse supervisor for 7UT.
Great. Jen, go ahead.
Hi, everybody. I am Jen Sparak, and I am the manager for our soon-to-be opened psychiatric emergency services here at the Med Center. I've been here for about 3 years and been planning and working on getting this program up and running for almost a year now. So I'm very excited to have this new program up and running and share a little more about that with you here in a bit.
Great, thank you. Kate?
Good morning, everyone. My name's Kate. I'm a supervisor in the emergency department on main campus. I've been there for 6 years. I came from another hospital, and I'm happy to see you all here.
Awesome. And then Annette.
Hi, I'm a nurse supervisor on 9 Trauma. It's a 38-bed unit. I've been a nurse for 20 years, but I've been on the trauma floor since it's been open, which is about 3 to 4 years. I don't know, time goes by so fast, but yeah, that's it.
Awesome. Awesome, thank you. So that's just so you get a little better idea of the units we're going to hear from, but I'm now going to have them go back around and just tell us a little bit more in depth life on their unit, cases they see, patients that they have on their units every day. So Brandy, you can kick it off again.
Absolutely. Okay, so 5 West, we are a 26-bed unit, but we do have the capability to go up to about 38 beds-ish. As you guys know, COVID, we kind of had no idea what it was going to bring, if we were going to end up like New York, where we had tons and tons of cases. So our organization chose to make some of my rooms more semi-private. So I do have the capability to open those rooms up to semi-private if need be. So the 26 beds, our nurse to patient ratios are about 2 to 3 on day shift and about 3 to 4 on night shift. So patients we see, so we are the med surg side of COVID right now. But we do see a little more progressive care level patients sometimes as well. So our acuity is extremely high. As I don't know if you guys know or not, but COVID patients, their acuity can change very, very rapidly. So the COVID patients we see trauma patients that Annette normally would see, but maybe they came back positive for COVID. Now they're on my unit. A cardiac patient that's usually maybe on the cardiac unit, positive for COVID, has to come to my unit. Cancer patients, whatever, anything and everything we see on 5 West. The only populations we don't see, we do not take any pediatrics. And then obviously if that patient needs even more higher level of care, maybe we're talking about extreme high oxygen needs or they need to be intubated, they would go on and hang out on Christina's unit. We would transfer them up to their unit. So we get more the med surg side of COVID. But like I said, acuity with the COVID patients can change very rapidly. And I think that's been the really interesting part for my staff. We hadn't seen this before. COVID was a whole new battle for us. And these patients can just change on a dime and they can get sick really, really, really fast. And that's been, I hate to say, it's been a little more exciting for our staff because like I said, we've never seen that before. So what you'll see on my unit, very, very fast paced unit, very busy, very busy. You stay busy the whole shift. We have a great teamwork culture on our unit. So our team works really, really, really well together. Yeah. Did I miss anything, Erin? I feel like I missed a lot.
One second. So Tara, Constance would like to join a different group. So I invited you in to help her with that.
No problem. Constance, what group would you like to join?
Oh, you're on mute if you're.
Can you please remind me of the other groups?
Neurology, cardiovascular, clinic, oncology, pediatric, and surgery.
I spoke with the pediatrics, labor and delivery. I would like to go for neurology.
All right, I will send you there now. Thank you, guys.
Thanks, Tara. Okay, sorry about that, everyone. Just want to make sure we got her in the correct room. So, did you speak about ratios and you did? Okay, perfect. And then, so let's go, we'll move on to 7UT, and I'm sure we'll think of some other questions as we go, or maybe as other people are sharing stories from their unit, you can jump in if that jogs your memory. So Christina and Emma, if you guys want to go next.
Absolutely. I forgot to mention, I've been at Nebraska Medicine for 12 years.
And I've been at Nebraska Medicine for a total of 7 years. I started as a unit clerk and then was a travel ICU nurse for a couple years and then came back to Nebraska Medicine.
Awesome.
So 7UT, like I said, is a newly established unit that was established for the pandemic. We are a 24-bed unit. The goal with COVID care is that if or when our numbers get low enough, 7UT would ideally be the only COVID unit at Nebraska Medicine. So that being said, we take all levels of care, so med-surg, progressive, and ICU level care. We also take adults and pediatrics. So any patient that were to come into Nebraska Medicine for any reason would come to 7UT if they tested positive for COVID. It is a unique opportunity to see a little bit of everything. So like Brandy kind of talked about, we get patients from all areas. They might have come in for a trauma, but then tested positive for COVID. They might be a cardiac patient, an oncology patient. It doesn't matter if they have COVID, they would come to the COVID unit. We, like Brandy talked about too, the acuity with our COVID patients changes very quickly. We get some of those med-surg patients, and then we also get the ICU. We do paralyzing and proning quite a bit up here with our ICU COVID patients. We do have a critical care team that is housed up here on the unit with us. They're here 24 hours a day, just to be a backup and to make sure that they're available for patient needs. So if we're ever concerned about a patient or we need more help, the providers are literally up here on the unit at all times, and we can just grab them and say, hey, come look at this patient with us. Respiratory is another department that we work really, really close with the high oxygen needs that we see on our unit. So they also have an office up here. They're here all the time and have really become a part of our team. Since we are a new unit, we are just working on establishing a core staff for this unit. This unit's been staffed over the last few months by all nurses at Nebraska Medicine. So nurses have floated into our area. So anybody that comes into our unit now, we really have the unique opportunity to kind of build our culture and build our unit into what we want it to be. We've seen some really awesome teamwork up on our unit. Just the nature of the work that we do, as you can imagine, once you get in a room with all your PPE on, it's harder to get out and grab something. So nurses really depend on each other. They really become like family. We don't allow visitors up on our COVID unit except for in extenuating circumstances. So as you can imagine, that's challenging for our patients. All of our patients have tablets, and our staff really work a lot with making sure that our patients are able to do Zoom calls, FaceTime, things like that, making sure that our families are kept up to date on what's going on with their loved ones and still feel a part of their care. But our staff up here very much become family to those patients while they're here. Do you have anything to add to that, Emma?
Just in discussing patient ratios, so up here is a very unique unit in that we do take all levels of care. So our med-surg level patients, PCU level patients, will typically have them be 1 nurse to 3 patients. With our critical care patients, they're typically 1 to 2. There is occasionally times when our ICU patients are so sick that they require to be a one nurse to one patient ratio. So it's a really unique environment. We are excited about getting to train nurses to take care of all levels of care, from pediatrics to adults and ICU to med surg. It's exciting.
I saw a question came across the chat about critical care for peds. We have been pretty fortunate, I think, as far as the unit has gone so far, that our peds numbers have been fairly minimal, and the pediatric kiddos that we've seen have not been very ill typically. We have had a few critical care pediatric patients, but those patients were critical care for other reasons and not, like, COVID was just kind of an addition to what was going on with them. So I don't know that our critical care pediatric patients have been much different than you would see in a PICU. And typically, if they're, a lot of the pediatric patients that we have gotten have been trauma patients initially. We are working, or we will be working on cross-training a little bit our staff to make sure that they're competent and comfortable in caring for pediatric patients that we might get up here. We're kind of just learning a little bit about what this might look like for the pediatric population, especially going into fall now. We're interested to kind of see what this fall looks like as far as how that impacts our patients with influenza and with our kids, specifically RSV. So I'm not sure if what we've seen COVID related with pediatric patients might change as we get into the fall a little bit more. So we're still learning quite a bit about that.
Awesome, thank you. Dawn, were you wanting to join a different breakout room as well? Oh. I can't hear you, but I know you were in this group last time, so it would make sense that you would want to join another group. If you just want to type it in the chat, I'll have Tara move you. She doesn't want to let me know. You said the ICU group. So we don't have a, let's see.
Hi, Erin, did you need help?
Yes, so Dawn would like to change to a group that has more ICU focus. I know we kind of have ICU sprinkled throughout. Dawn, do you want like neuro?
Neuro would be great, yeah.
Neuro, or we have cardiovascular surgery.
Either one of those, yeah. I'd say let's just do cardio. That sounds great.
Okay, perfect.
Cardio,
Thank
I
you
will
so
send
much.
you there.
Thank you.
Yes,
Thanks.
yeah. Okay. Sorry about that, everyone. So I think we are on to Jen now to talk a little bit further in depth about the PES and what that unit, what the vision is for that unit, short-term, long-term. Tell us all about it.
Yeah. So yeah, we are getting ready just very, very soon to open our psychiatric emergency services. And for all practical purposes, I think people are referring it to like a psych ED. Presently, that's where anybody who presents to us with a mental health concern is in our emergency department. So, you know, we refer to ourselves as the little sister to the ED. It might surprise some people to know that nationally 1 in 8 presentations to an emergency department is for somebody presenting with a mental health or substance use condition. And at Nebraska Medicine in the last 5 years, our numbers with that presentation have doubled. So we really knew we needed to create some space that was dedicated for somebody experiencing a mental health crisis. You know, emergency departments by their nature are taking care of some really, really critically ill medical patients. And that isn't always the same environment somebody who's in a mental health crisis needs to meet their needs in that time. So we created the space that really is kind of designed to not feel so much like a hospital environment. It's meant to be very sort of destimulating, very calming. So some intentionality as far as the color schemes. And really it's kind of like the hub for us to help people make decisions for what's the next thing they need. So we do not have inpatient mental health treatment here at the Med Center. So if that is something that somebody needs, then we help get that assessment done and move that person on to the next place they need to go. We also have, though, the ability to really provide some intervention for folks when they're in a mental health crisis that maybe then they wouldn't end up needing that transfer to inpatient care. You know, if it's somebody who has just stopped taking medications for a period of time, we'll be able to help with that. If it's something where they need somebody to help them make a safety plan so that they can live more successfully in the community, you know, we can be a part of that. Getting them linked to services with some of our really good community partners will be important for us as well. So really there's kind of a three-phase piece to the psychiatric emergency services. The first is that quick triage and assessment of kind of what's going on with this person. How did they get to us? Some will be voluntary, some will be folks that are brought in by law enforcement where something was going on in the community and they were brought in, and we kind of tease out what that is. Not surprising probably to most of us, there's a significant amount of stigma around folks with mental health conditions. And so we really want to be able to tease out really what is going on for that person and get them connected. After that triage and assessment, and that really is involved with an interdisciplinary team of psychiatrists, nursing, licensed mental health practitioners. We actually have peer support, which is a person who has got their own lived experience with mental health conditions on our team as well. So helping then to get that person kind of with some immediate treatment, whether that is one-on-one therapeutic treatment, doing some interventions or medications or both. And then lastly, that disposition discharge planning of where's the next place for that person. So designed to be less than 24 hours, but we do know we'll have some folks that will board with us just like they board in the emergency department now. But this is an environment that's meant to be for somebody with that particular need. That hopefully will also help our friends in the emergency department where right now patients that are there, they're in the same room for those periods of time. And our emergency department is very, very busy, as Kate will tell you. And we hope that will help with the throughput there. But most importantly, it will really be that place that, you know, affirms somebody when they're having a really difficult day and they really need that extra hand to help get them connected to the next thing. So that is what our goal is.
Awesome. So that is a nice transition to Kate, but Jen, I wanted to let you know you got a nice little chat there from Kaylee. So if you want to read that, that's super sweet of her. But Kate, if you can go ahead, this is always a nice transition into the emergency department.
Good morning, everyone. So in the emergency department on main campus, we're about 43 beds. That's divided up into a fast track area, a non-critical care area, and a critical care area. And then of course we have our trauma bay. We see about 65,000 patients a year. This year will be a little lower because of COVID. And we see about 160 to 220 patients a day. Kind of what Brandy was implying earlier, although our patient volume is lower than maybe last year, our acuity or how sick our patients are is much higher. So it's just an interesting, we're all learning and how to care for everyone. Something I forgot to mention in the previous breakout session, I also have a subspecialty. I do forensic nursing, so sexual assault nursing. We have a program on main campus for sexual assault nurse examiners. So if that's something anyone's interested in the future, I definitely would speak to them and can speak about that. Because we're an emergency department, we are a front door to our hospital. So we see everything. We serve our community for everything from an abrasion to a laceration to obviously a heart attack, a stroke, transplant patients we help care for, trauma patients we of course help care for. So to work in the emergency department, you need to be highly engaged, a lifelong learner. You need to be able to jump in and want to know about different areas. And the nice thing about it, so my little niche is sane, but all of my colleagues, we all have our little interest areas. We're all SMEs on different things. Some people are biocontainment. Some people are great at wounds. Some people are great, they have PEDS or NICU experience. So collectively, we are a great cohesive team. So that kind of lends itself to our culture. Our culture is definitely one that we depend on teamwork and we depend on each other. We can go from 10 patients in the emergency department to 60 patients in the emergency department in a matter of a few hours. So clearly to do that, we have to work together and just keep our patients in mind first. I'm welcome to any questions if you have any.
Great. Yeah, so Annette, if you want to go ahead and give the debrief on 9 trauma, then anyone that has questions, we will open it up after Annette.
Okay, yeah, so I'm on 9 trauma. It's a 38-bed unit. We are usually always full, even on the holidays. Most of our patients come from ED, the surgical ICU, and step down. The patients, of course, we're a trauma unit, so we have a lot of car accidents, assaults, gunshot wounds, stabbings, anything trauma. We also have emergency surgeries like APPEs, choles, and like a small bowel obstructions. So these patients, they don't expect to be here at the hospital. So we're dealing with a lot of psychological issues. We're dealing with a lot of head injuries. We're dealing with a lot of pain. So that's one part of the challenging part about my unit. You learn a lot of things. There's a lot of chest tubes, lots of drains. We have drips, lots of patients that require a lot of neuro checks, a lot of CMS checks. So you stay very busy on my floor. And as far as teamwork, we have to have good teamwork because most of our patients, they can't do anything on their own. Like a lot of them, they require 2 people to get up. We have a lot of turners on our floor, a lot of people that need direction because of all their head injuries. So yes, teamwork is a must. Otherwise, we could not get our work done. As far as culture, during trauma, we try to have everyone to have like a growth mindset. So we really try to support our new grads. We have lots of new grads. They learn a lot of things on our floor. Once they've been there a year, maybe they can start precepting. They start joining committees. We start to find new things, improvements on what we can do on our floor. My floor's only been open like 3 or 4 years, so we're still kind of new, like having all trauma patients. So we're kind of still trying to adjust to that and like, you know, trying to find better ways to do things and stuff like that. But yeah, 9 trauma is a great floor to work on. So I suggest it to anybody.
Awesome. Thank you all for giving that little description, but any questions that we have from our visitors, we would love to address those. We have about 5 minutes left in this room, so get in as many as we can. Any questions from you guys?
For the ED, do you guys hire new grads that had experience as a tech in the emergency room in another unit?
Yeah, we do have a fellowship program or nurse residency program. We hire at that August, December, and May. We usually hire 1 or 2 dependent on our needs in the department. That fellowship for the ER is a little longer than the residency on maybe a med-surg floor just because what you see is so wide and varying. So our residency program is about 9 months from beginning to end in the actual ER.
So Kaylee, are you a May grad?
Yeah, I'm a May grad. I've been working at Mercy One in Sioux City's ED. It's a trauma 2 since May when COVID actually hit. So I really enjoy it, and that's something I'm looking forward to. And I'm looking at other opportunities to get into an ED somewhere else.
Yeah, so I would definitely look toward the May fellowships generally posted in the spring, about March, February, March.
February or March, we'll have that posted, and I'll put my email address in the chat, and you can send me an email, and then I'll definitely let you know when we have that live and posted. So.
All right, thank you, Erin and Kate.
Yes, we also got a question about schedules. So I know that most units, if not all, use self-scheduling. Does somebody want to talk a little bit about that?
I can. So we use a computer system. It's called Smart Square, and it's kind of, we call it like a semi-self-scheduling. You go into that scheduling system and pick the schedule of your choice. But then most units also have a scheduler that comes back in on the back end and balances things out, just to make sure we don't have like 14 nurses one day and 2 the next. Most people get the majority of what they sign up for, and think I can speak for most teams at Nebraska Medicine. Staff here are pretty gracious and are usually pretty willing to trade people if they have needs or if there's a day that doesn't work for them. There's also the ability within that system to put in like requested days off. So if you have something going on outside of work that you want to make sure that you're not scheduled that day, you can put in a requested day off. There's also the ability to notate in there, if you're a student and you have a school schedule to work around, you can certainly put that in there so the schedulers know that you're not available those days. And then at Nebraska Medicine, we also have holiday teams. Team A and Team B. So if you were somebody that were to join our team, you'd be assigned to a team. Nebraska Medicine recognizes 6 major holidays. It's Memorial Day, 4th of July, and Labor Day, and then Thanksgiving, Christmas, and New Year's. So if you are on Team A, for example, you might work 2 summer holidays and a winter holiday this year. So maybe Memorial Day, Labor Day, and Christmas. And then next year it would flip. So that you would work 4th of July, Thanksgiving, and New Year's. That way, you know, if you work Christmas this year, you won't work it next year.
Awesome.
Did I cover that?
Yes, I was just answering Nicole's question here about float pool. We do have float pool, and if you're a new grad, we do take a new grad through a fellowship similarly to the emergency department, but you kind of start floating med-surg units, and then as you gain your comfortability, we kind of integrate those ICUs and get you up to par with everything you would need to know in the float pool, but that could be solely your position if that was an area you were interested in. Just trying to look here to see any other questions. We did have questions about forensics. I know we don't have a ton of time left, but Kate, if you just want to do a quick overview of a little.
Yeah, I'll briefly talk. So for forensic nursing at Nebraska Medicine is our patients, our survivors, are sexual assault survivors. We do a little bit with domestic violence and also with sex trafficking. How that looks on the nursing side is once you become a nurse, we advocate for you to start working and get good experience for about 1 year to 2 years. And then at that time, there's training you can go through the International Association of Forensic Nurses in combination with training with me. And that's about a year-long process. And then after that, you can sit for a board test. That's as fast as I can make it.
Yeah, thank you for that. Great job. Thank you, everyone. I'll see you in the main room. Welcome back, everyone. I hope you enjoyed your second breakout session. These are going by so quickly. Shonda, I did give you a name for the second Amazon gift card.
Yes, you did. So
ready?
I'm ready. So our second winner, and I apologize if I mispronounce your name. I can relate because it happens. Kaya Condon is our next winner. Yay.
Yes, yay. Kaya, are you still on? Well, either way, we will email you early next week with that Amazon gift card. So thanks for joining us, and thank you for announcing that, Shonda. That was very nice of you.
Congratulations, Kaya.
Okay, so at this point, we're just going to go through a real quick wrap up. And like I mentioned, if you are an experienced nurse and the new grad residency might not apply to you, you can definitely feel free to jump off after this. But before you go, if you just want to put in the chat what your favorite thing was about today and how excited you are to learn even more about Nebraska Medicine. Also in the chat, I guess my email address is up here on the screen. I was going to type it in the chat, but if you leave today and you had some questions that you didn't quite get answered, please feel free to email me. I would be more than happy to help you out. If you're ready to apply, nebraskamed.com/careers is where you will be able to find all of our openings. I will say that positions come and go on a daily basis. Constantly getting new recs approved as old recs are filling. So if you really have a position in mind that you're hoping for, you don't see it even today when you look, feel free to check back in a couple of days, or, you know, ask me about other positions that might be more similar, and we can get something figured out for you. We have plenty of openings right now, and we would love to have you join our team. If you are a new grad, I normally encourage new grads to start applying about 6 months out from graduation. So if you're a December grad, absolutely in that time frame, feel free to start applying now. If you graduate in May, get through the holidays, and then even at the start of the new year would be a great time for you to really start putting your applications out there. It's really nice to kind of have that interview process and job kind of off of your plate as you're finishing that last semester of nursing school and going through finals and boards and all that stuff. So definitely feel free to put yourself out there, apply to a couple different areas and see how it goes. But I want to thank you all for joining us today. This has been a great event for our first virtual. So much can go wrong with technology, but it seemed to be pretty smooth. So I really appreciate you all being here and spending your Saturday morning with us. So like I said, feel free to shoot me an email with any questions that you have. Otherwise, I can't wait to see you at new colleague orientation as our new colleagues here at Nebraska Medicine. So with that, I am going to give it over to Kaylee Guinan, and she is going to chat about the nurse residency program.
Hi, everyone. My name's Kaylee Guinan, and I have been a nurse at Nebraska Medicine for 23 years. Essentially, I started as a new grad and never left. I worked at geriatric rehab. Back then, we actually had a SNF that was part of the organization, and I worked there long enough to know I absolutely did not want a career in geriatric rehab. And so I transferred as soon as I was able to 5 West. And I worked on 5 West for 7 years, and that's where we say I grew up. I grew up on 5 West. 5 West and a lot of the other med-surg floors are fabulous because you see so many things, and it really gave me a rock solid foundation for the rest of my career. 5 West split into 5 West and CPCU. And when that split occurred, I went to the CPCU side, and I worked there for another 7 years as a nurse, a team leader, and an educator. I have worked every shift, every FTE, and in quite a few roles. And at the time, I had little kids, and I was very tired from working nights. And so I moved to employee development. And I worked in employee development, and that transitions to nursing professional practice and development into my current position. And I am right now the manager of the nursing professional development specialist. I am also the nurse residency program coordinator, and I kind of have my hands in a lot of things that are nursing education related, whether that is education competencies, students, practice, shared governance. I kind of have a little bit of everything. And the favorite part of my job is that I see students or care techs who become nurses, and I see nurses who become team leaders or supervisors or managers or preceptors or council leaders or committee chairs. And I see them grow throughout their career and take advantage of the opportunities that we have. And that's kind of why I love my job and why I'm staying in the education arena for the moment. So that's a little bit about me. If you can move forward a slide, I'm going to tell you a little bit about the nurse residency program. So nurse residency programs are the informal term for a transition to practice program. Transition to practice programs came about because we know without a doubt that it takes an entire year for someone to transfer into a new role. And that is true for nurses or pharmacists or anyone for if you get a degree and put time into your education, it takes a year. And we know that transitions in general are rough. Transitions in healthcare are even rougher. And so we wanted to have a way to support new people from when they start through that first year and then on into whatever their career path is. Nebraska Medicine has used the Vizient AACN nurse residency program since 2009. And what the nurse residency program is a way to help you to grow, learn, adapt, and essentially become a competent, confident professional nurse over the course of time. People get nurse residency programs confused with all the other stuff we do. And so no matter what, when you start, we're going to give you a solid orientation with a preceptor. You're going to go to a lot of classes that are house-wide topics and whatever your floor focus is clinically. We'll give you a lot of education on that. Pretty much everyone has a fellowship of some sort. That's not really what nurse residency is. That's the clinical component. Nurse residency is more about you and making sure that you transition brain cognitively and emotionally throughout that time. It's critical thinking. It's you making the adjustment to, oh my gosh, when I'm off orientation, the patients are my responsibility. It's being a bedside leader. It's learning how to communicate. It's learning how to be a lifelong learner. That's more what the program is about. Because we've been doing this a long time, we absolutely know what topics residents need and when they need them, and that's how we structure the program. For example, in the first month or two, we'll teach you about resource management, communication, and getting yourself organized. In the middle, we'll talk a little bit more about quality outcomes and evidence-based practice. At the end, we'll teach you more about professional growth throughout the rest of your year. So basically, we give you what you need when you need it so that you can learn a little bit more. And all of this is based on evidence. If you go to the next slide, with with the nurse residency program, how we do this is we meet monthly for the first year that you're employed as a nurse. We wait a month or so to start that because we want you to get situated a little bit. But the nurse residency facilitators that you see on the screen will meet with you. And we group people according to like areas or the floors they work on or women's and children's all together. And so for the first hour or two of a nurse residency day, you're with the large group and my partner, Erin, and we are talking about the topic of the day. And then with the second hour or two, you break up and you go with your small group, which is usually about 5 to 15 people, and you do something specific to that area or go on a field trip or do an activity of some sort. And we'll do that throughout the entire year. And that's, like I said, activities, a big portion of nurse residency and what we hear from residents the most is that they like the small group time where they do what we call Tales from the Bedside. And Tales from the Bedside is a way for you to increase your circle of support. And it's also the people in your cohort group kind of become your people. They're your support system on the floor and they're the resources that you go to. And in most cases, they become your really good friends. So it helps with that, but it also helps you to increase your knowledge. Because no offense, when you start in nursing, your knowledge bank is pretty small. But when you hear about how your peers had this situation happen and how they handled it and what they did, that makes your knowledge bank grow a little bit too, because the next time you have that situation, you'll stop and think, oh my gosh, Ellie did this, that, and it gives you more knowledge than you had. So everyone loves Tales from the Bedside. With the nurse residency groups, we start a cohort 3 times a year, and we do that to coincide with graduation dates. So December grads become the March cohort, May grads become the July cohort, and July or August grads become the November cohort. And we have, every group is a little bit different, but they follow about the same size of people. So the most people graduate in May, so that's always our largest cohort of the year, with 120 to about 180 people in that. And then the December group is usually about 60 to 70 people. The July-August group is about 40 to 50. And so someone typed a question in here, how are we doing nurse residency with COVID? Well, I'll tell you, we're doing it very differently for each session. For the smaller groups, we divided it in half. So we have 25 people coming to stores 1 through 8, and we can social distance that way. For some of the larger groups, we'll do the first hour or 2 with the larger groups via Zoom, and the second portion with the smaller number of people in person. We've been absolutely taking it one session and 1 day at a time. We didn't want to totally cancel nurse residency because of COVID, because if we know it takes a year to transition, we didn't want to leave people hanging. So we have absolutely made it work. It's just different than it was before, and we're going with it. And if you'll go to the next slide, I want to tell you guys why you need a nurse residency program. And I hope you come to Nebraska Medicine, but if you don't, ask if they have a nurse residency program, because this slide explains why you need it. On the left-hand side of the screen, it shows on that axis at the bottom of you being complete distress, despair, and kind of a hot mess, all the way up to you being perfectly happy, healthy, and well-adjusted. On the bottom axis of the screen, it talks from the left-hand side of you being a brand new nurse all the way through your first year. Like I said, it takes a year to transition, and we know that that transition includes 4 stages, which is called reality shock. And that is the honeymoon phase, when you're on top of the world and so excited to be learning things, down to the shock phase, where you realize that you feel like you learned more in your first 2 weeks on the floor than the last 4 years of nursing school, and you're kind of freaking out because of all the responsibility, up to you recovering and then resolving. So that's sort of the natural curve of your first year. But if you look at that blue line, if you have a nurse residency program in place and you have the supports that you need built in already, when you hit that shock phase, you do not hit as low and you can recover faster. And that's why we feel this program is so important, because we know that you're going to hit there, and we want to support you when you do, so that it's not as bad and you already have a lot of things built in to help you through that. And so that's why we feel so strongly that the nurse residency program is needed. And that's how we build the program, like I said, to give you what you need when you need it. So that was sort of high level about the program itself. I am very happy to answer any questions that you have. So I had a question, is there testing in this program? No. We do collect data, but it's not knowledge-based. It's to ensure that you're transitioning. And those questions are more like, I feel supported on my floor, my preceptor is helping me, I knew how to handle a situation. It's more those types of questions. Some of the fellowships actually do have pre and post tests because we want to measure learning outcomes at Nebraska Medicine. And so all of these programs are not one after the other. When a new grad starts, you will have orientation on the floor. Well, you'll start with the first week of hospital orientation, and then you'll go to orientation on whatever floor that you're a part of. During that orientation, we fit in a lot of classes that we send every nurse to. Like we're very passionate about patient safety. So every nurse will go to a zero harm class. During your orientation, you'll go to those normal classes. And then say you're on cardiology, you'll go to the cardiac fellowship. Say you're a med-surg nurse, you'll go to the med-surg fellowship or oncology. All of those are paced at certain intervals so that we don't completely overwhelm you at once. So nurse residency meets monthly, 4 hours a month, okay? Some of the fellowships do where they meet monthly as well. So you'll have 4 to 8 hours every month of the fellowship too. Some of the fellowships do it where you meet every week for 4 weeks to get some of those concepts. It just kind of depends, but all of them are sort of mishmashed together where over your first couple months, you're doing these things. You may come off orientation before you're even started the fellowship, or you may be done with orientation, but still part of nurse residency. It all kind of goes together. So another question about new grad, are they hired into the program? Any new grad nurse who is hired at Nebraska Medicine and going to work in the inpatient areas is part of the nurse residency program. So you will be hired by your floor and you'll be automatically enrolled in the program. When you go to a nurse, the first nursing orientation class will give you a schedule and tell you, we color code them all so we can keep them straight. Monday, we're starting the Ruby group. We'll tell you, hey, you're in the Ruby group and here's the schedule for the year. You don't have to apply special or say, I want to do it. We automatically enroll you in that. What else you guys got for me? I'm happy to answer any questions. I don't see any more rolling in, so I will let you know that this is a good place to work. Like I said, I've worked every FTE, every shift. The beauty of nursing is that there's so many career avenues that you can take. I've got this going on in my life. Hey, I found out at 35, I'm passionate about education. Let me go get my master's and my work paid for it. Let me do this. There's a lot of avenues that you can take. Like I said, ask about nurse residency programs because we know that you absolutely need it. We've been doing this for a long time and we know new grads and we feel like we can support you well. So I welcome you to apply. If I also do preceptor students. Precepting is school, nurse residency is work. And so for preceptor process, you have to go through your clinical faculty that does preceptor placements. For example, Clarkson is Jen Rankin. South Dakota State is Robin. You have to go through your school to ask for a placement. You do not reach out to the floor directly because we have a process in place. If we can host you, we will. I will tell you that we have an academic agreement with both Clarkson and UNMC. And so we do place those students first. And then after that, we'll take as many as we can. This semester, we're hosting, I think it's 6 local colleges. So if we can take you, we absolutely will, but go through your faculty. I am going to hand it to you, Erin, if no other questions come up.
Sounds good. Thank you. That was great. So I hope that helped you guys a little bit, gain a little bit more information. I know there were a couple of questions about whether you apply to the nurse residency or apply to a specific position. You definitely would go ahead and apply to your specific position, and the nurse residency would just kind of follow naturally. It's not something you have to have a separate application for. So just keep that in mind. You're not missing anything. If you're like, how do I get in there? Just being a new grad nurse is going to allow you to join that program. So I hope you guys really enjoyed today, and I appreciate you hanging out with us for a couple of hours this morning. So with that being said, we will wrap up, and thank you guys so much for joining us, and enjoy the rest of your Saturday, and we hope to see you here soon.
Thank you.
Everyone.
Thanks a lot.
Thank you so much.
Yes.
Thank you.